Hey everyone, this is Dr. Marcin RX, and in today's video, continuing the topic of neutrophilic dermatosis, we'll be discussing about Sweet's syndrome. So Sweet syndrome, it is also called as acute febrile neutrophilic dermatosis or gum button disease. So it is a disorder that is characterized by the occurrence of tender, non-pruritic erythematous papules and plaques, and they are sudden in appearance. So coming to epidemiology, females are more commonly affected, and the most common age group that we see Sweet syndrome in is the 30 to 60 years of age, and there is no racial predilection. Coming to etiology, on the basis of etiology, Sweet syndrome is divided into three groups: the classical group, the malignancy associated group, and the drug induced group. So the classical group, it is characterized by the presence of fever, and it occurs due to upper respiratory tract infections, inflammatory bowel disease such as ulcerative colitis and Crohn's disease, gastrointestinal tract infections, viral and fungal infections. Then the malignancy associated group, it is associated with both hematological and solid organelle malignancies. In hematological, the acute myeloid leukemia is commonly known to cause Sweet syndrome, and in solid organelle malignancies, carcinoma of breast, gastrointestinal tract malignancies, and genitourinary organelle malignancies have also been associated with Sweet syndrome. Coming to drug induced, the granulocyte colony stimulating factor induced Sweet syndrome is most common among the drug induced Sweet syndrome, and other drugs such as the oral contraceptive pills, NSAIDs, imatinib, propylthiouracil, antiepileptics, retinoids, and minocycline have also been known to be associated with Sweet syndrome. Certain autoimmune disorders such as systemic lupus erythematosus, Sjogren's syndrome have also known to be associated with Sweet syndrome. Coming to pathogenesis, so there are three main factors that may have a role to play in the occurrence of Sweet syndrome. The first being genetic susceptibility, and the second is it is a type of hypersensitivity reaction to certain infectious agents, drugs, and tumor antigens. And the third one is that it can occur as a result of immune dysregulation. And for this immune dysregulation, there are various external and internal triggers which in turn cause an Th1 response, which leads to increased production of IL-1, GCSF, GM-CSF, as well as interferon gamma, IL-3, IL-6, and IL-8, which further causes neutrophilia. Coming to clinical features, there can be general features, cutaneous features, oral mucosa features, and extracutaneous features. So the first general feature is fever. So it is an acute febrile neutrophilic dermatosis. So fever is the most common presenting symptom, and it occurs preceding any kind of appearance of lesions. And the second feature is constitutional symptoms. It can be either arthralgia or myalgia, headache, malaise, or a combination of these. Coming to cutaneous features, so it is characterized by the occurrence of tender lesions, and these lesions, they can be erythematous to purple in color, and the primary lesions, they can be papules, plaques, or nodules. And these plaques, they have sharp irregular borders, and the sites that they are commonly seen are the head, neck, trunk, and upper extremities. And there is also a dense dermal edema, as a result of which the plaques have a shiny appearance, and they also look like vesicles. But they are not true vesicles, they are pseudo vesicles. There is no defect in the dermoepidermal junction, but it is merely because of edema of the dermis, and that is why there is an appearance of a vesicle, hence they are also called as pseudo vesicles. So other cutaneous lesional variants are bullous lesions. They can be seen in malignancy associated Sweet syndrome. There can be pustular lesions seen in inflammatory bowel disease associated Sweet syndrome, or there can also be subcutaneous Sweet syndromal lesions. And skin pathology test is positive like any other neutrophilic dermatosis. Coming to oral mucosa lesions, so oral mucosa, it is involved in malignancy associated Sweet syndrome, and they can be either aphtha-like lesions or papules, nodules, bullae, and vesicles, and there is also associated periodontitis, and ulceration of the palate and buccal mucosa can also be seen. Coming to extracutaneous features, so eyes are involved, and it can present either as blepharitis or conjunctivitis or episcleritis and iridocyclitis. Bones, they can be involved asymmetrically, and the type of arthritis seen is non-erosive and sterile, and the most common joints affected are the knees and the wrist joint. Coming to involvement of the central nervous system, this is something called as neurosweet syndrome, and it can present as benign encephalitis or a septic meningitis, or as brainstem lesions, or even it can cause psychiatric symptoms. Next, respiratory features are in the form of bronchial inflammation and aseptic pleural effusion, and other organs that can also be involved are the kidneys, the liver, the heart, and the muscles. Coming to diagnosis, so skin biopsy is kind of the main gold standard for the diagnosis, and here we can see that, as the name suggests, it is a neutrophilic dermatosis. So there is going to be dense diffuse neutrophilic infiltrate throughout the epidermis, throughout the dermis, and it may extend into the subcutaneous tissue, and intense dermal edema, as we discussed, is also going to be present. And epidermis, it can occasionally show like subcorneal pustules and intraepidermal vesiculation, but the presence of dense dermal edema and dense diffuse neutrophilic infiltrate throughout the dermis is the characteristic feature. However, there can also be histological variants such as the histocytoid variant or the lymphocytic variant or the eosinophilic variant. Coming to criteria, so we've got 2 major and 4 minor criteria. And in the major criteria, acute onset of the typical lesions of Sweet syndrome and dense neutrophilic infiltrate on biopsy are the major criteria. And in the minor criteria, presence of temperature of more than 38 degrees centigrade and preceding association, so preceding upper respiratory tract infection or GI infection or association with malignancy or drug exposure or pregnancy is to be present. And an excellent response to systemic steroids is something that is characteristic of Sweet syndrome. Along with that, presence of other lab abnormalities such as ESR of more than 20 millimeters per hour or WBC of more than 8000 per microliter, or positive or raised CRP, and presence of more than 70% neutrophils, any 3 of these lab abnormalities are to be present. So a diagnosis is made of Sweet syndrome when 2 major criteria and 2 of the 4 minor criteria are present in a given patient. Coming to treatment, so treating the underlying disorder, treating the underlying infection or malignancy or any drug exposure is necessary. And for mild cases, we can go for topical corticosteroids, and intralesional triamcinolone can also be tried. But in most cases, systemic therapy is required, and the first line are going to be corticosteroids. So prednisolone we can give at a dosage of 0.5 to 1 mg per kg per day, and it is to be given for a period of 4 to 6 weeks. And if there is no response even after 3 months, then we have to stop the steroid, or we can also go for a steroid sparing agent. And then potassium iodide, it can be given as a saturated solution or as an enteric coated tablet, and the dose also varies depending upon the patient, how they are able to take the potassium iodide. So we can go for 300 mg TID if it is an enteric coated tablet, and if it is a saturated solution, then starting with 3 drops TID each day, and then increasing by 1 drop TID to a final dose of about 21 to 30 drops per day is something that is done. Then colchicine in a dosage of 0.5 mg TID can also be tried for up to like 3 weeks, 2 to 3 weeks. Then second line agents such as indomethacin 150 mg per day, or dapsone 100 to 200 mg per day, or other agents such as cyclosporine, clofazimine, interferon gamma, interferon alpha can also be tried. Thank you. Subscribe for more.